Good morning, everybody. I'd like to thank Professor Mohammed Muqdadi and all organizing committee members inviting me to do this presentation about the extraintestinal manifestations of Helicobacter pylori. As we know all, H. pylori infection has been clearly linked to peptic ulcer. It is a known infection in pediatric age as well as in adulthood. But possible association of disease states in the organ system, which is named extraintestinal manifestations of the H. pylori. So, in fact, if we go through the association between H. pylori and the extraintestinal associations, there is strong association with iron deficiency anemia and ITP. There is moderate association proved by some studies, vitamin B12 deficiency, chorioretinopathy, psoriasis, and neurological disorders, and weak associations with glaucoma, urticaria, alopecia, autoimmune bowel disease, and metabolic disorders. So we'll go through these different classifications and we'll demonstrate how it is important to detect the H. pylori and eradicate the H. pylori in case of positivity in all these clinical situations. First of all, for the hematologic extraintestinal manifestations, we'll speak about the iron deficiency anemia and the ITP. For the iron deficiency anemia, we know the iron deficiency anemia is one of the most common nutritional deficiencies worldwide. In our region, the prevalence is going from 20 to 50%. In childhood under 5, for example. In our country, in Syria, it is proved that the level of anemia, it is around 29% of cases. And we know that the first publication which demonstrated the relationship between H. pylori and the iron deficiency anemia was published in 1991. Later on, many other studies reported and described the association between H. pylori and the refractory iron deficiency anemia in pediatric age, and as it is in adulthood. To explain, there is many mechanisms to explain the relationship between the H. pylori and the iron deficiency anemia. For example, the increased iron loss, the development of peptic ulcers, the development of decreased gastric acidity, so the decreased level of the iron absorption, and the iron uptake by the H. pylori. Many other new studies demonstrated that there is other deficiencies related to the H. pylori, not only the iron, but there is the copper, the zinc deficiency associated with the H. pylori infection. The last one was published in 2022. In summary, H. pylori infection has been well studied in relation with the refractory iron deficiency anemia. That's why the guidelines demonstrated that you have to eradicate the H. pylori in case of presence of the iron deficiency anemia in refractory cases, and even there is no effectiveness of the treatment of the iron deficiency anemia by iron. ITP. H. pylori infection is a well-known cause of secondary ITP. It is proved worldwide. And the prevalence of H. pylori infection in patients with ITP is higher. More than 24 observations studies, more than 1,500 patients significantly demonstrated this association. And we know that if you treat the H. pylori during the ITP, you are more effective in the treatment, and the long-term prognosis of H. pylori related to ITP has been studied and appears to be excellent. So think about the H. pylori in case of ITP. To explain the mechanisms immune thrombocytopenic purpura, it is the induction of the platelet aggregation, it is the production of antibodies, and more other mechanisms to explain why this association. In summary, you have to treat and to eradicate all cases of H. pylori in case of ITP, and the current American Society of Hematology guidelines have suggested to treat the H. pylori in case of ITP. Vitamin B12 deficiency anemia in association with H. pylori. We know that since 2012, there was many studies demonstrating the relationship between H. pylori and vitamin B12 deficiency. And all these studies in 2012, 2017, 2019 demonstrated that you have to treat the cases of H. pylori to treat and to ameliorate the treatment of vitamin B12 deficiency. Now, we will move to the general diseases related to extra-intestinal H. pylori manifestations. We'll speak about the growth retardation and metabolic syndrome disorders and insulin resistance. In fact, more than 15 different studies demonstrated on more than 5,000 population or patients demonstrated there is some association between the growth retardation and the H. pylori infection. That's why all recent studies demonstrated the importance of the treatment of H. pylori in case of growth retardation to ameliorate the growth later on during the life. What about the metabolic syndrome and insulin resistance? In some studies, there was some arguments demonstrated that there is some relationship between the metabolic syndrome and the infection by H. pylori by the activation of pro-inflammatory and vasoactive substances. But other studies didn't prove this relationship, including some studies done in Arab countries like in Lebanon. So actually, we cannot say that it is proved 100% that there is a relationship between the insulin resistance and the H. pylori infection, but you have to treat all cases of H. pylori for any diabetic case or insulin resistance. Fibromyalgia. Some recent studies in 2020 demonstrated that the presence of H. pylori and the antibodies of H. pylori is more prevalent in case of fibromyalgia. That's why they are recommending to treat all cases of H. pylori or detect H. pylori in case of fibromyalgia. It could be more effective if you treat the H. pylori in this case. Now, we will move to the ocular manifestations associated with the H. pylori. We'll speak about the open-angle glaucoma and the central chorioretinopathy. For the open-angle glaucoma, it was demonstrated in more than 10 studies that the prevalence of infections of the H. pylori is more prevalent in this case in a publication and review published in 2021. And it was demonstrated that the normalization of intraocular pressure and mean visual field parameters after treatment of the H. pylori is more effective. What about the central chorioretinopathy? The prevalence of H. pylori has associated with this disease, and it looks at if you eradicate the H. pylori, you are effective in more than 40%. Neurological manifestations and extra-intestinal manifestations of H. pylori, we speak about especially the migraine and headaches. We know all that among patients with migraine, different studies has shown increased prevalence of H. pylori. And several studies demonstrated that the following eradication of H. pylori, a significant proportion of migraine report no further headaches of reduction in the severity of symptoms in more than 17 to 84% of cases. Some other studies didn't demonstrate the relationship between H. pylori and the migraine and headaches. In summary, H. pylori may be associated with the severity of migraine attacks, and more studies are required and needed to prove the association between the two. Many skin manifestations could be related to H. pylori, extra-intestinal H. pylori manifestations, like the chronic spontaneous urticaria, the rosacea, the psoriasis, the chronic urticaria, alopecia, and autoimmune villus disease. We start one by one. And we'll start by the chronic spontaneous urticaria. We know that in a meta-analysis of 22 different studies, it was demonstrated that the H. pylori is highly positive in this case. And if you treat the H. pylori, you could ameliorate the effectiveness of the treatment. Rosacea, which is a persistent central facial erythema, could be associated with eye symptoms. It is prevalent from 1 to 10% for childhood. And so there is some linkage between H. pylori and the rosacea in some studies. And the production of antibodies could be responsible of this. And some studies demonstrated that if you eradicate the H. pylori, you could ameliorate the effectiveness of the treatment of rosacea, as well as psoriasis. Psoriasis was demonstrated clearly that H. pylori in a patient with psoriasis showed dramatic superiority if you treat the H. pylori to ameliorate the psoriasis in 79% of cases, comparing with 30% in non-H. pylori infection. What about the chronic urticaria, which is an autoimmune disease? We know that the production of H. pylori antibodies could be responsible of the aggravation of chronic urticaria, and the clinical improvement was noted if you treat H. pylori. Alopecia, which is related to the production of antibodies, it is prevalent in 2% of the general population. Some studies demonstrated that if you treat and eradicate the H. pylori in case of alopecia, you could ameliorate the effectiveness of the treatment. What about the autoimmune Bell's disease, which is, as we know, an autoimmune disease? The effectiveness of the treatment is ameliorated 79% if you eradicate the H. pylori. So in conclusion, at the end of this presentation, we could conclude that many extraintestinal manifestations could be associated with the H. pylori infections. Many studies proved the association between the H. pylori and other aspects and extraintestinal manifestations. Many other studies didn't prove many clinical aspects of extraintestinal manifestation H. pylori, but the recommendation that you have to think about H. pylori in case of extraintestinal manifestations, and it could be the beneficial for sure if you eradicate the H. pylori in all cases. And thank you for your listening.